Hello and welcome to Nightline, HealthLine. It is night, but it's HealthLine. I'm so glad you joined us this evening. I'm Jennifer Blomquist. I have the privilege of hosting the program. And if you are new to our show, welcome, and you will enjoy it. And I guarantee you will learn something. I learn something every week. I've been doing this show for 18 years and never ceases to amaze me all the information you can get out of this program. So there are two things that I want to tell you about. We are live in the studio right now, and we keep the phone number up at the bottom of your screen. The reason we do that is because we welcome any calls you may want to put into us, any questions you may want to ask our doctor tonight, where we have a surgical oncologist. We're going to be talking about lung cancer. Maybe you have a question about yourself or somebody you care about. So free advice, you can't beat that. Give us a call at any time. It's 969-2720. If you're outside of Fort Wayne, it's still a toll-free call. Just dial 866 in front of that. And when you call in, you have two choices. You can either ask your question live. They don't just throw you on the air, by the way. You'll talk to a very nice call screener. They will tell you just to wait, and then we'll get your question answered live. The other way you can do it is you can just give the call screener your question, and I'll ask the doctor for you. I like the live option because sometimes the doctor may want to ask you some questions to better answer, give you a better answer. So do whatever makes most sense for you, but just want to make sure you are aware of that. We have a familiar guest joining us. He has been on our program before, Dr. Yahanda. Thank you so much.
Oh, thank you for having me.
Great to have you back. As I mentioned before, you are a surgical oncologist.
Correct.
And just came back to the area about a year and a half ago.
Mm-hmm.
So we were so incredibly fortunate to have him here. I didn't realize this, but November is Lung Cancer Awareness Month.
That's correct, yes.
So I think everyone knows October is Breast Cancer Awareness. I feel like that's pretty established, but lung cancer is very prevalent as well.
Oh, very much so.
Yeah.
In both men and women, it's the second most common cancer.
Yeah.
In men, behind prostate cancer, and in women, behind breast cancer. So it is a very prevalent cancer in both men and women.
And, you don't hear much about it. I guess people probably always assume that if you have lung cancer, it's because you were a smoker.
Right.
But in my own family, my aunt passed away. She never smoked a day in her life, and she ended up dying from lung cancer when she was just 45. And it was a horrible ordeal. So that opened up my eyes then I met more people after that knew of people who had lung cancer, but had never smoked.
Right.
So,
well,
obviously smoking's not good. That's
right. Certainly smoking is associated with the vast majority of lung cancers. But probably about 80 to 90% of all lung cancers can be traced to smoking. But for those that didn't smoke or had no history of smoking, probably the next most common cause of lung cancer is radon exposure.
Oh,
so
right.
For those who don't know, radon is a colorless, odorless gas that is found naturally in the ground. Yeah. It is a breakdown product of uranium, and it just leaks up through the ground. So for example, in a house, anytime there is a break or a crack within the foundation of the house, radon can leak through. A very common place for it to leak through is in a sump pump, for example, because that is really a break in the foundation. And radon is heavier than air, so it tends to accumulate in the lowest part of the house. It also happens to be that Fort Wayne is in one of the highest zones for radon. So the EPA divides it up into zones 1 through 3. Zone is 1 is the highest. And Fort Wayne is right in the middle of the Zone 1 area. So we have a very high rate of radon here, and so again, that is probably one of the main causes of lung cancer in non-smokers.
I feel like in Fort Wayne, the basement is a big deal. Like people are really into finished basements here. I realize in some parts of the country, like Florida, they can't do basements because of such a high water table. But basements are huge here. And I grew up in Northern Illinois, and it wasn't really a thing. Then I came here, and everyone said, oh, no, you got to have a finished basement. And it's funny you bring that up, because I remember my father-in-law, when he went to sell his house years ago, that was an issue, was the radon level. So is that something you can have checked?
Absolutely.
Or should you, I don't even know, who do you call to do something
Absolutely.
like that?
Well, you can get radon testing kits online.
Oh, self-testing.
But also there are companies that will do it for you.
Okay.
But if you do get a high radon level detected, you'll need to get a professional involved to do what's called abatement. So it's essentially a venting system where it's a venting fan that will vent that air out and then expel it out the roof of the house.
I'm glad you're telling us this because I never really thought about it. And I think a lot of people spend time, especially if you have teenagers and stuff, they like to hang out in the basement.
Absolutely.
So good advice. I was going to ask you, besides the radon, how prevalent would secondhand smoke be?
Oh, absolutely. That's also known to be a cause of lung cancer. So mind you that really smoking-related cancers are directly correlated with the length of time that a person has smoked or is exposed to smoke, and then the amount, right? So if you are inhaling secondhand smoke from a very heavy smoker, even though you didn't smoke yourself, that is a big risk factor. Yeah.
What about just living with somebody who smokes? Like maybe you're not, because I know there are some people where it's a couple and one smokes, one doesn't, and the agreement is the person who smokes goes outside, but they still smell smoky and the home smells smoky. Does that have an impact?
Probably a little, but it's really mostly the inhalation of the actual smoke, the combusted tobacco product.
Yeah, all right. Definitely interesting things to think about for sure. I just want to remind everybody, because our callers sometimes tend to call in later in the show, and we'd hate to miss your question tonight, so that's why, again, we keep that phone number up at the bottom of the screen. I just want to remind you that we'd love to hear from you. We have great things to talk about, but please feel free to call anytime. It's 969-2720, and again, if you want to make it a toll-free call, if you're outside of Fort Wayne, just put 866 in front of there. So what would you suggest to people, especially during this month when you're focusing on lung cancer? Are there things that, even if you're a non-smoker, things that you should be thinking about, or symptoms to look for? I'm not even sure, except maybe I've heard some people say it hurts when you have, that's the first symptom is pain.
Right. Well, unfortunately, the lung cancers don't often give symptoms until they're fairly advanced, and so that's the need. That's the reason for screening, is to try to find them before they become symptomatic. And that's, we'll go on a little aside here, and that's actually sort of one of the fallacies of why people think they don't need screening, is they'll say, well, I don't have any symptoms, why do I need to get screened? But in fact, they're the exact people we want to screen because they aren't having symptoms, and so because of that, we could probably catch a cancer earlier if it's there.
That's not something you hear. We hear all about the breast cancer screenings and prostate and so forth, but what are the guidelines for lung cancer screening? And I don't know if it's by age or it depends on your lifestyle.
Yes, so it's by age and also by amount of smoking you've done. So depending on what guidelines you're following, the ones we most often follow are those related to Medicare, what the government will pay for. So Medicare guidelines are anybody between the age of 50 and 77. You also have to have had a history of smoking of what's called 20 pack years. And the way you calculate pack years is by taking the number of packs smoked per day and multiplying it by the number of years that you've smoked. So for example, if you smoke 1 pack a day for 20 years, that's a 20 pack year history of smoking. So again, 20 pack year history of smoking or greater, or have had a history of smoking that amount but quit within the past 15 years. So also related to that is that you don't have any symptoms related to lung cancer. And to answer your previous question about what are the symptoms, common symptoms would be shortness of breath, cough, a persistent cough, not just occasional cough. Blood-tinged sputum or phlegm when you cough. Chest pain, but that would be a fairly late sign. And then really unexplained weight loss as well. So those, but if you don't have any of those symptoms, then you would qualify for a lung screening CAT scan. So again, age 50 to 77, 20 pack year history of smoking or greater, or quit within the past 15 years, and then no symptoms of lung cancer. And then you are a great candidate to get screened.
And just nobody wants to do a screening that's inconvenient or painful, but
Right.
I've heard it's just like a CT scan.
Oh, it's very straightforward.
It's not like a
very easy.
colonoscopy.
Absolutely,
It's not like that. It's much easier.
Yes, it's pretty quick. It's about 10-15 minutes.
wow.
Absolutely pain-free, non-invasive. So
Yeah.
you don't need an IV put in, so you don't need contrast
Nice.
material. So it's just lying on the CT scanner, getting the scan, get up, and you're on your way afterwards. So it's
Yeah.
very quick, painless. There is inconvenience of having to go to the center to get scanned, but that's really about it.
Yeah. Well, what is I don't know if you can measure it by percentage, but how good are the screenings? Like, how early could you possibly catch it? Is it just looking for like spots on your lung?
Yeah,
Is that-
exactly.
Okay.
So the way a lung cancer will first present is as a small little dot in the lung tissue,
Okay.
and it'll show up as a dot on an X-ray. So that an
Okay.
X-ray looks at relative densities of tissue, and so a cancer is denser than the surrounding lung tissue, and so it looks like just a dot, what we call a nodule.
A nodule, okay.
Right? So it will show up as that, and over time, if nothing is done about it, it'll grow bigger and bigger and bigger, and then will likely cause symptoms, which will then prompt the person to go to their physician and get a scan. But if we can do it earlier, catch it earlier, when it's just this little dot,
Yeah.
then we have a much better chance of curing it with treatment.
I was going to ask what are the treatment options, and with a nodule, are they automatically cancerous if you see them? You don't. Okay.
No, in fact, the vast majority of nodules are benign.
Okay.
So they're either scarring or perhaps
Okay.
an old infection or something of that sort. But only about 4% of all lung nodules will end up being cancerous.
Okay.
But if you take all the lung nodules that we find on CAT scans for whatever
Yeah.
reason, it's a large number of nodules that we find. But luckily, again, not the minority of those will be worrisome.
So if you went for the scan and they noticed these spots, what would be the next step then? Do they
Well, it
come back
depends
in?
on several things. It depends on the size of the nodule that they see. So
Okay.
if it's really small, so less than a half an inch in size or so, then probably can just be watched and followed.
Okay.
If it's larger than that, it probably needs some kind of further investigation with another scan, or perhaps a bronchoscopy or a look down into the lungs with
Okay.
a scope.
Yeah, I didn't know.
But-
Can they I don't know if they
Yes.
do biopsies
Yes,
in the
they
lung.
can.
Okay, they can.
Yeah.
All right.
So it all depends on the size and the character too. Some nodules are very, very dense, or what are called calcified nodules.
Oh, okay.
And those are almost always benign. So if you see a calcified nodule, we can usually just let those go and not do anything
Okay.
further about them, not have any other scans at all.
Yeah, I was going to ask. I think most people know the colonoscopy. If it looks good, you've got 10 years. You
Right.
don't have to go back. So if everything does look okay, how often
You're
do
only
you
good
repeat
for
it?
a year.
Oh,
So-
just 1
right,
year.
1 year.
Okay, all right.
And part of the reason for that is that lung cancers, we all usually think of cancer as being fairly slow growing, right?
Yeah.
So, but lung cancers can be very aggressive and can grow very quickly. And so we may not have seen a nodule this year, but within a year you can get a fairly good sized nodule.
one.
So that's why we need to follow them up every year.
Well, I remember doing this program years ago, and there was somebody from a local health center, was a nonprofit agency, and she brought, I don't know what they had done to these, it was actual lungs, but they had been, preserved. And she brought a set from somebody, that hadn't smoked, and then she brought a pair from somebody who had, and it
Right.
was just frightening to see. They were shriveled, they looked shriveled up, and she said because they primarily work with kids, and she said, I always tell the kids, just think about if you took your lungs out and put them in the oven for like 10 years, that's kind of the same thing as smoking every day, but it was just unbelievable
Oh, yeah.
how unhealthy the smoker's lung
Right,
looked.
the lung is black in color,
yeah.
or blotches of black here and there. Yes, it's not a good-looking lung.
Yeah, and I am surprised that I still see so many people smoking today.
Oh, I am too.
I mean, there's been a huge campaign for, gosh, I mean, I'm old, and it's been around since I was in high school. I remember, you know, the pretty strong about, you know, don't smoke, and yeah.
Yeah, well, you know, I think in general, anti-smoking campaigns have done a good job, and we know that the incidence of lung cancer is dropping, and it's been dropping over the past 2 to 3 decades. And I think it definitely coincides with when a lot of the anti-smoking campaigns were going into effect, and then, you know, decreasing smoking in public places and such. So definitely incidence is going down, and so is mortality. So I think the anti-smoking movement is working. We just have a lot more to do, especially in the state of Indiana.
Yeah, I've heard that we have a pretty high rate of smokers.
So we have about 16% of the adult population in the state of Indiana are smokers. Yeah. And that we rank 7th worst in the United States as far as numbers smoking.
Gotcha. So. And I don't want to get too far off track, but I do see a lot of people vaping, and I think they feel like that's quote unquote the safe way to smoke. I don't know what your thoughts are on that.
Well, you know, vaping has not been around for that long.
Yeah.
I mean, or very popular for that long.
I feel like, like 5 years.
And so we don't have a lot of follow-up time on these. Remember, I was saying that it's a matter of amount and time for develop the lung cancers. So I think we'll know a lot more in the next several years. But right now, we don't have a whole lot of data to directly implicate vaping with cancer. There's some preliminary data suggesting that. But I think there's a really interesting study that really puts vaping in a bad light, and that is that there was a study looking at about 5,000 people with lung cancers, and they then looked at those who smoked and those who smoked and vaped.
Okay.
And those people who smoked and vaped were about 4 times at higher risk for getting a lung cancer than those who just smoked alone.
Oh, wow.
So that has to suggest that there's some bad effect, some negative effect on the lung that vaping has that either somehow accentuates the effect of smoking or makes it worse conditions or better conditions, I guess, for a lung cancer to form. And I think that probably all has to do with inflammation, and as we know inflammation is very much associated with the start of or the incidence of cancer. So I think it's the inflammation in the lung plus the smoking that really makes it a great environment for lung cancer to form.
I mean, I've never seen anybody like right next to me do it, but I've seen people from a distance, and I don't know what, it's like you don't see their head.
Right,
like
it's
just
plume
covered
of
in smoke.
Yes.
I don't know why people thought that was a good idea, but and I'm not trying to be discriminatory against people, but it just seemed like there would be some negative side effect to doing that every day.
Well, probably the most common injury or problem we see bad problem in the lungs with vaping is an entity called EVALI, which is e-cigarette and vape associated lung injury. Oh. And it's a horrible problem in the lung. It's severe inflammation. People often need to be on ventilators or breathing machines until all that inflammation dies down, and then they can breathe better again. But yeah, it's a bad thing, and does cause a lot of injury to the lung.
Well, yeah, just don't do it.
Right, exactly.
Just don't do it, and encourage. If there's somebody in your family, I would just highly suggest try and have a conversation with them about that. Probably 2 or 3 minutes ago, they showed me the card to say that we're down to 10 minutes, so we're probably down to 7 minutes or so right now. We could still squeeze in a few questions, so I just want to remind you one last time to please call if you have any questions about lung cancer or Lung Cancer Awareness Month. There might be some local organizations maybe doing screenings or programs, so look that up, or maybe you want to go online and find out more information about that. Make it a priority.
Just to put in a plug for that, November 8th, so this coming Saturday, is National Lung Cancer Screening Day.
Okay.
So a lot of healthcare organizations around this area are doing scans or screening
like
scans.
Mobile,
or just at the hospitals.
Just at hospitals, okay.
And so they're open for business to scan people on Saturday.
Okay. Good.
So I would encourage you to, first of all, talk to your primary care to make sure that you are eligible for screening and that you do satisfy those criteria I talked about before. And then if you do, then I would encourage you to go on Saturday or whatever days convenient for you, but to get your screening scan done.
Yeah, all right, make it a priority for sure. What, if somebody does have the diagnosis of lung cancer, is surgery usually the next step, or are there more conservative steps you can take before that?
Well, it all depends on the stage of the cancer, how likely it is that it's localized.
Yeah.
So if it's very much localized, so just confined to the lung itself, then surgery is usually the first route of therapy. If it's spread further to the lymph nodes, then it might be a combination of surgery plus chemotherapy or radiation therapy. But if it's spread elsewhere to other organs, then it's usually just chemotherapy and immunotherapy that would be used.
What, in general, what is the survival rate, or does it depend on what your stage is, I imagine?
Yes, very much so.
In general, is it improving the number, or?
It is, and I said that the mortality rate is improving, and likely because of, again, decreased amount of smoking, but also I think it's very much due to improvements in our treatment, and we've had some really tremendous advances in treatment over the past 10 years or so, and that's using immunotherapy, and we've been having some very amazing results with that. But to answer your previous question about survival rates, so yes, it all depends on the stage of the cancer. So if it's localized, still isolated just to the lung, the 5-year survival rates are in the 60 to 70% range.
All right.
Once it spreads to the lymph nodes, it's now down to in the 30-35% range, and then if it's metastatic, meaning spread elsewhere, then we're in the single-digit numbers.
Yeah.
So again, that just speaks to how important it is to catch these as early as possible, and why screening is so important, and we need to get everybody out there to get screened. Yeah.
Maybe even get the word out, because like I said, I think the whole, I had a doctor one time tell me that there was so much going on with the breast cancer awareness campaign that a lot of other cancers took a back seat.
Right.
So, he was, trying to work with, for other cancers that have very high rates, affecting both men and women, to try and, get the word out.
Right.
So.
Well, I think it's well deserved to try to put more attention on lung cancer and lung cancer screening. If you look at the compliance rates with screening, meaning those who are eligible for screening based on those criteria, and those who actually get screened, in the state of Indiana, we're only at about 16%. In some of our local data, we're seeing that it's more around 4 to 6%. So few people are getting screened that really should get screened.
I did notice that a call came in,
Sure.
so we'll just, it was somebody that wanted me to ask it for them. So let's see, how does rayon cause lung cancer?
Well, again,
sounds like this person has a personal connection, like something has happened within their family.
Sure. So radon, as I said, it's a gas. It's a breakdown product of uranium, but radon itself is radioactive.
Okay.
So I believe it's most likely that it's the chronic exposure to a low level of radioactivity that's causing damage to the lung and damage to the lung cells, which then cause the lung cancer.
Okay. And that's something, again, most people probably don't even think about that.
Right.
I think the only reason they caught it at my father-in-law's is because it was part of the deal when they were selling the house. They wanted to test, or had to test for it. Right. So I realize if you're a smoker, that predisposes you to getting cancer, but what if you had a relative who didn't smoke and who had lung cancer? Does it tend to be, do you have to worry about a hereditary factor then?
That's a good question. And lung cancer is not often related to an inherited syndrome.
Okay.
But there are now more and more data that there are some genes that are associated with lung cancer.
Okay.
One of them is a fairly common mutation in a gene called P53, which is, but most often that's associated with cancers of the colon, lymphomas, a rare tumor called a sarcoma, but they are finding that lung cancer can be associated with that. There's also some mutations in the inherited mutations in the EGFR gene, which is the epidermal growth factor receptor gene. But really, hereditary lung cancer probably represents less than 10% of all cancers. So it's not as common as other cancers might be.
All right, interesting.
Yeah.
Well, our time is up. I mean, they're
Oh,
telling me to
goodness.
wrap up the show,
Yeah,
believe it or
well,
not.
yeah.
It's so fascinating. You're such a wonderful guest. I really appreciate all that you
Thank
share
you.
with us. Thank you.
I appreciate you having me.
Got to get you on the list again for later this for this coming year.
Okay,
So
would love
thank you,
to.
Dr. Alan Yahanda, and I'm Jennifer Blomquist. Thank you so much for tuning in tonight. Really appreciate it. Hey, I won't see you again till December, so have a happy Thanksgiving and happy Veterans Day to all of you vets next week. Thank you for your service. Have a good night. Bye-bye.
PBS Fort Wayne was made possible in part by
Momentum, progress, innovation. Parkview Health knows standing still isn't an option. We must learn, grow, excel, and actively work to advance healthcare for our community and beyond. With technologies that improve access to care and teams of specialized providers, we are moving healthcare forward. Right here at Parkview Health.